Hi, everybody. General Von Hoffman here behind the mask, fabricated in the CMXG parachute shop. Super proud of my mask. And here with Dr. Pepper from our OCMED flight. And Dr. Pepper, thank you so much for being back. And we just have a few follow-up questions, if you don't mind. Great. So the first one, we're learning of multiple ways and products to sanitize our workplace, more than we ever thought. Could you tell us, are these chemicals safe?
Yeah, so these chemicals that we're using on base are proven effective and safe by the EPA and then recommended by the CDC. So most of these chemicals have been vetted through the safety. And as far as the CDC and the EPA go, they actually recommend following the instructions on each of these chemicals. More specifically, the MSDS sheet, or the SDS sheet is now called. And that will give you directions on the correct PPE to wear when using these chemicals. Just kind of as a reference, cleaning professionals throughout the world use these chemicals on a daily basis, and they don't suffer any long-term health effects from it if they wear the proper PPE for each of those chemicals. So the chemicals themselves are safe. They're more of a concern of direct contact to the skin if you inhale it, or contact to your mucous membrane. It's an irritant to those areas. So you can have kind of acute reactions to the chemicals with that. But long-term health effects, as long as you wear your PPE, are really non-existent, yes. I think the one thing I would caution is mixing these chemicals. So there's a lot of chemicals that have ammonia, there's a lot of chemicals that have chlorine, and when you mix those two together, you can have a toxic gas that forms from those. So don't mix the chemicals.
Great, thank you. Dr. Pepper, would you please give us an expert answer on what the benefit to the workforce of wearing a face covering while at Ogden provides?
Yeah, so the best benefit is that we're preventing droplets from spreading. So for instance, I'm standing here talking, and if I were to cough or sneeze, the droplets would not go to you, ma'am, or contaminate this whole area. And I think a lot of what's driving this mask thing is the new research that shows if a person can go pre-symptomatic for up to 48 hours and spreading the virus before they develop the symptoms. And so if I'm not symptomatic now, but if I were to cough and sneeze, and then tomorrow morning I woke up with symptoms, then you would be quarantined, your whole office would have to be cleaned, and that's what we're trying to prevent with the spread. And it's really that within 6 foot distance, you really need to wear the mask, but anytime you can wear a mask and prevent the spread of the droplets, that's greatly reducing the spread of the disease itself.
Okay, thank you for that, and I want to put a quick shout out to everybody who is wearing a mask right now, because they have to work within 6 feet of another person. Thank you so much. And the masks are almost fully deployed. Everybody should have one that needs one, and the masks keep coming. So you'll have one, and you'll probably have one to wash, so you can alternate. Dr. Pepper, can you tell us about the revised CDC guidelines on individuals who would be at higher risk to complications of COVID-19? Hypertension, I think, is one. Are there others that we need to address?
Yes, so this is a growing body of research, and as we treat more ICU patients with this. And if you look at the data now, most people in the ICU do have hypertension, but that's because that's one of the most prevalent diseases in our nation is hypertension. If they look at what's really making people severely ill with the COVID-19, it's the diabetes, the chronic heart disease, and the chronic lung disease. So those are kind of the conditions that we really worry about with people, and if they do catch the disease, those are the conditions that are putting people in an ICU and on a ventilator. And only about 50 to 80% of those people are getting off the ventilator. Hypertension alone, if it's well treated, is something that they've recently taken off of the list, because it's not something that's really a chronic heart disease. So that's come off, and they've also added obesity, especially as we treat more young people. The obesity is something that's also putting people in the ICU, so they've added that onto it. So hypertension's off, obesity's on, but it's really down to the chronic lung, the chronic heart disease, and the diabetes. That's really getting people ill in the ICU with this COVID-19.
Obesity with a BMI over 40.
Over 40, correct, yes.
Okay, all right, super, thank you. And then one last question. Are there any changes to the process to return to work for presumptive cases that end up with negative results, or if you're directed to quarantine with positive results.
Right, this is kind of a complicated, there's a lot of pieces in presumptive, positive, and quarantine isolation. So the biggest change is that people who are quarantined and don't have any symptoms don't have to call the occupational medicine clinic and really don't need to call their primary care provider. For instance, you're at work and somebody at work is presumed positive. Your supervisor can send you home for self-quarantine until those test results are back. If those test results come back negative, then your boss can say, come back to work, the test results are negative, we've cleaned the area, that's fine. If the test results come back positive, then you're quarantined home for those 14 days, because that's the incubation period of the virus. So you want to make sure you stay home for those 14 days. At any point, if you become symptomatic, call occupational medicine or go get tested, or both. I know there's prescriptions out there for people to take directly to get testing, and we highly recommend testing. As of just Friday afternoon, Dr. Dunn of the state epidemiologist, they have expanded testing in the state of Utah for any symptoms. You don't have to have all 3 symptoms, you just have to have 1 symptom. So if you have a symptom, go get tested, call the occupational medicine clinic, and we will then track you through this process. So the big difference is not having to call occupational medicine if you're just sent home to quarantine and you have no symptoms. Yes.
Okay, great.
Yeah.
All right. Thanks, Dr. Pepper, so much for joining us again, and appreciate your time and everything that the folks in ACMED Flight are doing for us.
Thank you, ma'am.